7 treatments for brain cancer.
Number 1.
Surgery. Surgery is usually the first treatment used for a brain tumor. The aim of surgery is to remove as much of the tumor as possible, while minimizing damage to surrounding healthy brain. Sometimes it is not safe or possible to remove all visible tumor tissue because it is too close to important areas of healthy brain. Other aims of surgery are to provide a large specimen for examination by the pathologist, to confirm the diagnosis and help guide treatment, to relieve the pressure on the brain. This can improve symptoms and may reduce the amount of drugs the person needs to control symptoms, to reduce the amount of remaining tumor to be treated with radiotherapy and chemotherapy. These treatments may be better tolerated and have less side effects if there is less tumor left to treat. If the brain tumor is located near a part of the brain that controls speech or movement or some other vital function, it is common to perform the operation when the patient is awake for a short part of the surgery. The patient is woken once the surface of the brain is exposed, and special electrical stimulation techniques are used to locate the specific part of the brain that controls speech, movement, or vision. This avoids causing damage while removing the tumor. Sometimes a tumor cannot be removed because it would be too dangerous. This is called an irresectable or unresectable tumor. In this case, the medical team will discuss other treatment options with the patient to ease symptoms.
Number 2.
Radiotherapy. X-rays and other forms of radiation can destroy tumor cells or delay tumor growth. Radiotherapy is recommended for all people with high-grade tumors if they are well enough to have this treatment, because it can prolong their survival. Radiotherapy starts as soon as possible after the diagnosis of high-grade tumor, usually 2 to 6 weeks after surgery, when the surgical wound has healed. Treatment generally takes place Monday to Friday for about 6 weeks. Radiotherapy may be given when the tumor is growing or becoming more invasive, or when surgery is unsuitable.
Number 3.
Chemotherapy. Chemotherapy is the use of drugs to kill cancer cells, usually by stopping the cancer cell's ability to grow and divide. The goal of chemotherapy can be to destroy cancer cells remaining after surgery, slow a tumor's growth, or reduce symptoms. Chemotherapy is typically given after surgery and possibly along with radiotherapy. Chemotherapy drugs may be delivered intravenously or directly into the cerebrospinal fluid, CSF, via injection or orally. Chemotherapy is recommended for all patients with glioblastoma multiforme, GBM, who are well enough for the treatment. Chemotherapy normally begins at the same time as radiotherapy and normally continues for 6 months after radiotherapy. For people with lower grade tumors, such as grade 3 astrocytoma, if chemotherapy is used, it is given after radiotherapy. In some cases, implants containing a chemotherapy drug are inserted during surgery into the cavity left after the visible tumor is removed.
Number 4.
Radiosurgery. Traditional forms of radiotherapy expose both healthy and tumor tissue to high doses of radiation to reduce tumor growth. Newer methods of radiotherapy, called radiosurgery, are highly precise, exposing only tumor tissue and minimal surrounding tissue to the radiation. Through precise targeting of the tumor, higher doses of radiation can be used, reducing the number of doses needed and the risks and side effects associated with the treatment.
Number 5.
CyberKnife. The CyberKnife delivers multiple beams of X-rays using a robotic arm. It is image-guided so can adjust to the natural movements of the organs and work anywhere in the body. It is used for the treatment of certain lung, brain, spine, liver, and prostate cancers which otherwise may be inoperable, or where other treatment options may compromise other vital organs. CyberKnife treatments are delivered in one session or can be staged over several days. Typically, brain cancer treatments are completed within 5 days. For most patients, the CyberKnife treatment is a completely pain-free experience. The only CyberKnife currently available in Australia is located at the Sir Charles Gairdner Hospital in Perth, Western Australia.
Number 6.
Gamma knife. The gamma knife delivers gamma rays to a highly defined target within the brain. The gamma knife utilizes a lightweight frame to hold the head in place and provide a reference point for targeted radiosurgery. Imaging is performed prior to radiation treatment to ensure that the gamma knife's beams are focused on the tumor site. Working together, neurosurgeons and radiation oncologists identify the target and develop a plan to deliver an extremely accurate dose of radiation while reducing exposure to sensitive healthy tissue. Treatment sessions can last from a few minutes to an hour. Gamma knife surgery is performed at Macquarie University Hospital in Sydney, New South Wales. The first gamma knife technology to be made available in a public hospital in Australia is at the Princess Alexandria Hospital in Queensland, with the first patients expected to be treated from September 2015.
Number 7.
Proton beam therapy. Proton beam therapy is an advanced form of radiotherapy which targets tumors with great precision and where the radiation dose can be significantly and safely increased to help eradicate the cancer. Protons are positively charged particles found in the nucleus of every atom. Protons are made available in this therapy by stripping away electrons from hydrogen atoms. As protons move through the body, they slow down, causing greater damage to surrounding cells. Due to this unique property, proton therapy causes minimal damage to healthy tissue as it enters the body and almost no damage to tissue as it exits the body, unlike traditional radiation therapy. As a result, the radiation oncologist can increase the dose to the tumor while reducing the dose to surrounding normal tissues. Proton therapy is used in the treatment of certain solid cancers in children, tumors of the eye and base of skull, and is becoming the treatment of choice for cancers of the head and neck, brain and spine, prostate, lung, gastrointestinal tract and breast. There are currently no proton therapy facilities in Australia. The first proton therapy centre is scheduled to open in 2018 at the Mater in Queensland. A second proton beam therapy facility has also been scheduled for development at the South Australian Health and Medical Research Institute. It is expected that this new facility will treat 800 cancer patients a year from 2020.